I think that we need to be prepared to help each other out.
Juravinski Hospital ICU Dr. Bram Rochberg says his team stands ready to help COVID-19 patients from Saskatchewan if needed, but he doesn't expect they will have to.
At least in the short term, I don't think it's the plan because of the burden that we're still dealing with.
Rochberg says Hamilton ICUs are
still under an incredible amount of stress. We're struggling with volumes and numbers of patients.
And to protect the ICUs from the added burden of more patients, Rochberg says none from Saskatchewan have been sent to Hamilton, Halton, or Niagara.
Hamilton and the region around here has probably been hit with this fourth wave harder than any of our other areas across Ontario.
Why do you think Hamilton's been harder hit than other places?
It's a great question, and I don't know if it comes down to our socioeconomics or whether it comes down to our vaccination rates. Compared to other centres around, the Toronto area, the Ottawa area, they are lower.
Numbers from Hamilton Health Sciences and St. Joe's show a combined total of 11 COVID patients in ICU as of Friday. Rochberg says relative to the spring, that number is much smaller.
But they've been sick and young. Lots of people in their late 30s, 40s, almost all unvaccinated.
Saskatchewan's ICUs are faring much worse than Ontario's. That's why Saskatchewan Premier Scott Moe says the transfers are being done. 6 patients were sent to Ontario last week and 3 more were expected this weekend. Saskatchewan's Provincial Emergency Operations Centre says roughly 2 to 4 a day will be arriving on Monday, Tuesday, and Wednesday. The federal government is helping too, approving a request for help from Saskatchewan, including military support.
What the Premier Moe has done is soft mandates that are doing nothing.
Doris Greenspun of the Registered Nurses Association of Ontario calls Premier Moe's handling of the fourth wave reckless, saying health guidelines have not been strong enough. Saskatchewan dropped all guidelines from early July to September, when self-isolation for infected residents was reinforced. More have been added since, but healthcare workers have continued to advocate for more measures as hospitals became overwhelmed. Greenspun says while Ontario ICU nurses are ready to help,
we are quite furious that their own government is not helping.
The Ontario Hospital Association is also urging Saskatchewan to do more, writing in a statement to CHCH News that the province needs to implement all available health measures at its disposal in order to save lives and reduce the burden on its healthcare system.